Almost 10,000 mine workers at Sibanye-Stillwaters have also been vaccinated. Now, tracking that story for us is my colleague, Heidi Giokos. Heidi, I saw you early this morning braving the chill of Westonaria there at Sibanye-Stillwaters, doing a brilliant crossing early this morning. Now, you're back with us here in Johannesburg. What happened at the Sibanye-Stillwaters today, this morning, when you were there?
So we do understand, Bradan, and I must say it was very, very cold this morning. I'm glad the sun is out now. But we do understand that just under 10,000 miners at Sibanye-Stillwater have been vaccinated to date. We know that the vaccine rollout program started about a month ago with the plan to vaccinate 80,000 workers at Sibanye-Stillwaters. And we do understand that once 75% of the workforce is vaccinated, they are going to start moving into families of the workers as well as the communities nearby the mines and where the workers move into after work. The reason for this is because they believe that miners are highly exposed. We do know that they work in very closed and confined spaces, which poses an even greater risk. We do understand that they're trying to vaccinate a lot more people a lot quicker. We know there are 4 vaccination sites specifically for Sibanye here in Gauteng, and they vaccinate about 600 to 1,000 people per day. We know that they vaccinate from Monday to Sunday, operating hours 7 a.m. to 7 p.m. So the efforts are there, the vaccination sites are in order, but one issue they face is the fact that they would have liked to vaccinate a lot more people, but of course this is all central to government's vaccination rollout program. So whoever's eligible to get vaccinated, Sibanye-Stillwater will coordinate its vaccination rollout program together with government's vaccination rollout program, and everybody needs to register on the electronic vaccination data system. They're seeing an uptick because the age group 35 to 49 is able to vaccinate already, so they're seeing a lot more people coming in. But let's listen to the Chief Operating Officer at Sibanye speaking about the actual vaccine rollout plan and how it's going.
As a company today, we've got 4 sites, primary sites, that have been recognised by the DOH. Each of those sites can administer in excess of 500 vaccinations a day, and we're busy rolling out a further 4 satellite sites, which will also do in excess of 500 a day. And really our capacity is constrained mostly by the number of doses we get and feet we can get through the door. So we certainly look forward to rolling that out more aggressively in the coming months, and certainly supporting the national vaccination strategy as we move forward. We have about 80,000 employees in our company, including contractors. That'll certainly be our initial focus for offering the vaccination to. As it stands today, we have currently vaccinated just under 10,000. Once we've got through a lot of our own employees, we certainly look forward as well to rolling out this program to dependents and families, and then ultimately the communities in which we operate. So I do think we have the ability to certainly play a significant role in assisting with the program.
And I'm just wondering, Heidi, did you manage to speak to any of the mine workers who've been vaccinated or waiting to be vaccinated?
Yes, we did get a chance to speak to a couple of them, but one particular miner we spoke to indicated to us that this couldn't have come at a better time. He falls under the cohort 35 to 49, and he had been waiting for some time to get his vaccination. He explained the working conditions that most miners are subjected to, how confined the space is, how when they go underground there are a large number of people and it's very difficult to social distance. He also mentions the fact that a lot of the miners are asymptomatic and nobody really knows when somebody could be carrying the COVID-19 virus, and it becomes a lot more complex and frightening to work in such conditions. But we saw many miners and many frontline staff at Sibanye standing in the queue today to get their vaccines. We also saw the security personnel at the various mines queuing up today at Sibanye-Stillwaters to get their vaccine. So it's great news. It's welcomed because we do know that workplaces are, of course, pushing, especially those that are exposed and feel as though their workers need to get the vaccine as quickly as possible, are now starting to get the vaccine. But let's listen to one of the miners who explains his whole process of getting the vaccine.
It's very important. It was very, very important for me to get vaccinated as I'm working underground in the mine. Whenever we go underground, we actually in the cage when we go underground, it's more than 50 people who's supposed to go underground on the cage. So it's very, very important, as it's very difficult for us to be socially distanced as we go inside the cage. So for us to get vaccinated is very important, so that we can reduce for us to be infected if someone is infected, because this virus sometimes people don't normally get the symptoms. So we actually don't know if someone is infected or not infected. So it's very, very important for us to get vaccinated.
Okay, that comment there by the mine worker there at the Sibanye-Stillwaters, concluding that report by Heidi Giokos.